Yanayojiri. Mimi naitwa Ali Manzu na moja kwa moja tunaanza na taarifa kutoka katika bunge la seneti ambako waziri wa afya Afya Duale alifika mbele ya seneti hii leo ili kupeana taarifa yake kuhusiana na hali ya afya hapa nchini, akikabili changamoto mbalimbali ambazo zimeweza kuchipuka na namna ambavyo wizara yake inaendelea kukabiliana nazo. Mojawapo ambao ni changamoto kuu ni ule usimamizi wa ile bima ya jamii ya SHA. Moja kwa moja tuanze na taarifa hiyo.
Honorable Speaker, what are our long-term strategies in place to enhance access to quality healthcare by persons with this condition, with hearing impairments? The ministry is implementing the National Ear and Hearing Care Strategic Plan 2023-2028. This is a very comprehensive framework, and it's designed to expand both ear and hearing services across all levels of care in our health ecosystem. And this plan helps to establish hearing clinics in all the sub-counties and integrate prevention, screening, and treatment into the primary healthcare services under UHC. So to strengthen the workforce, our community health promoters, our maternal and child health nurses are being trained both at our middle-level colleges, at our universities. They will be trained in prevention, in early detection, and in referral. Concurrently, the University of Nairobi and KMTC and the Kenya Institute of Special Education are also scaling up how they can produce more audiologists and more speech, language, and therapists. Honorable Speaker, when I saw this question, I had to talk to the DG who is here. And I can confirm that as a country, we have serious shortage of specialists, even speech therapy. Even when we put the cochlear implant into our children at tender age, they recover very easy to hear. But the biggest problem is they recover and they take long on the speech therapy. So it's something we have seen, and I think we will talk to our training institutions and more Kenyans and to bring the curriculum and work through. Thank you, Honorable Speaker.
Senator Sifuna, do you have any supplementary question?
Indeed, Speaker, I do. Unfortunately for me, the ODM expert on PWDs is not in the House today, Senator Crystal Asige. But I do, if my memory serves right, we did pass as a House an amendment, Honorable Speaker, and I thought we touched on this question of taxation of assistive devices. It just doesn't make any sense why a government would impose VAT on essential components such as hearing aids. But I want to assure the minister that we'll be following up when that tax conversation comes up to see that this government actually does away with taxation on those essential hearing aids. But since the CS has pegged down the capping of receipt of these assistive devices to 18 years to the cost of the product, and if you look at the response, it's saying that it is a cost containment measure driven by current resource constraints. Does the CS or the ministry have empirical numbers? How many people above the age of 18 in the country, or what percentage of the population is actually in need of these things, so that we actually know that it is a heavy cost to government and you're not just telling us stories? Because you've told us here you are undertaking actuarial assessments, which I believe must be based on data and numbers. Do you have those numbers, Waziri, on how many people above the age of 18 in Kenya require these assistive devices? I thank you, Honorable Speaker.
Senator Dulo.
Thank you, Mr. Speaker. A quick one. Waziri, I have a patient who has a heart problem and currently admitted at Tenwek Hospital, Bomet. Now, what I'm getting is that SHA is paying 537,000.
Now, Senator Dulo, You know the
I am
subject
building
of the
my question,
the
Mr.
subject
Speaker.
of the primary question.
Mr.
You know
Speaker,
it.
I'm building my case. It's
Okay.
on SHA. I'm just inquiring.
Yeah, but the question at hand, the primary question, is
Mr.
actually on the devices.
Mr.
The
Speaker,
aid.
I raised my request earlier on when actually Senator Hamida was on the floor. And
So it's
even
not
before.
related to this question.
No, it's on SHA, Mr. Speaker.
I will allow you.
Thank you. So, Waziri, this patient is in the hospital and the bill is about 1.1. SHA is paying 530 something. The patient is supposed to pay the balance. Mostly on heart problems, people actually seek where they can be able to get quick response to their issues. I'm told there are criteria, or rather there are categories of payment for different hospitals and different diseases. So I really want to know more specifically on that particular patient or heart. I have about 4 patients from Isiolo who are having similar challenges, actually going around to raise funds to meet the cost of the operation. So do you have categories of hospitals and diseases that you pay different charges, especially those patients who are covered under SHA? I thank you, Mr. Speaker.
Senator Haji.
Thank you very much, Mr. Speaker, sir. Mr. Speaker, sir, before I go straight to the question, I just want to state that as the Senator of Garissa, I am very happy and proud when I hear senators like Cherargei and Cheriot and Senator Sifuna praise the CS of Health, who happens to hail from Garissa. Senator Sifuna, you did say that he answered your question. No, you said he answered your question and you were very happy with his answer. So as a Senator of Garissa, we're very happy and we're very proud of our son who hails from Garissa and he's got a very busy ministry and is doing a good job, and we want to wish him all the best. Mr. Speaker, sir, since regional cancer centers were established, they've been supported by the Ministry of Health through the supply of essential oncology drugs, which covered over 24 treatment regimens, including those for breast and prostate cancer. Over the past 1 year, we've seen a significant reduction in the supply of these oncology drugs. I would like to ask the CS to clarify whether if there has been any policy shift regarding the provision of cancer treatment drugs from the national government to the regional cancer centers, and how such changes affect facilities in marginalized regions such as Garissa County. Thank you, Mr. Speaker.
Senator Eddie Okech.
Thank you, Mr. Speaker.
Mtazamaji, ni kikao ambacho kinaendelea kwa sasa katika bunge la Seneti ambapo